Good afternoon, distinguished guests, participants, and the viewers of the webinar. It's a proud moment to extend my warm wishes on behalf of Soundarya Institute of Management and Science, Bangalore. I want to convey my heartfelt gratitude to our guest for the day, Dr. Lakshman. I sincerely welcome Mr. Kirtan Kumar, CEO of Soundarya Institute of Management and Science. My heartfelt welcome to our principal, Suresh C. Hegadi, sir. IQAC head, Mr. Shivakumar Ganachari, and the head of the department, Mr. Girish, and Mr. Kaushik from the Department of Management. I, Malarvili, Faculty of Business Administration, Department, feel proud and honored to introduce our chief guest for the day, Dr. Lakshman, who have completed his MBBS from Bangalore Medical College and Research Institute. He traveled to UK for further studies and have obtained a fellowship from Royal College of Surgeons. Dr. Lakshman is a dedicated and hard-working personality and puts all his possible efforts in betterment of his patients. He holds membership of many honorable groups and associations. He also likes to attend seminars and conferences that takes place across the nation in order to increase his knowledge about the latest advancement in the field of medical science. He is a consultant for gastrointestinal problems, a laparoscopic surgeon, an associate editor for Indian Journal of Surgery, faculty of gastrointestinal in Rajiv Gandhi University of Health Sciences. He is also a chairman and a life trustee for Bangalore Medical College Development Trust and Infosys Bone Marrow Registry. Now, without any delay, I would jump on to the topic of the webinar today, misconceptions of pandemic. We all know that from 2019, we are facing a serious pandemic situation in India and all over the world. This has constituted and also continuing in the year 2001 also. But in this pandemic have given rise to many Google doctors, self-medications, and so on. We really get influenced by many forward messages, talks, etc. For example, we've been hearing the dropping of a lemon juice into the nose will evade the COVID disease. And over the counter medicines have also popped up. We also have become a sandwich between do's and don'ts for COVID. Now, let's be on a clearer path by discussing all the doubts and queries with our guest, Dr. Lakshman. Viewers who are watching from the YouTube channel can also raise their doubts through the chat box or a comment section. Thank you. Over to you, Dr. Lakshman, sir.
Yeah, thank you very much. I hope you can see my screen and that I'm visible and audible.
Yes.
Okay, thank you. Good afternoon, everybody. Thank you very much for this unique opportunity to interact with non-doctors. It's very common for us to have very regular webinars and discussions on various aspects with our own colleagues, but I always find it very interesting and I'm always enthusiastic to have interaction with non-doctors because we learn a lot. We learn a lot from the kind of doubts they have, from the kind of requirements they have. And so we get a layperson's perspective of a given issue. And today's topic, I think, is something which is very, very relevant. It's about COVID-19 facts and myths. Myths are, something which are really flourishing, as Ms. Muller said, because of the social media and what I call a lopsided covering of the coverage of the news by the visual media, the TV and the like. And so I think it's high time that we had a discussion. I will be focusing on the facts. There are far too many myths. I may mention one or two myths, but I would like the audience to raise questions about whatever doubts you may have, and if I know the answers, I'll be happy to answer those. Before I delve into the subject, let me thank Soundarya Institute of Management and its office bearers for giving me this opportunity, and Ms. Muller for her very kind words. COVID-19 has taken the world by storm, and it is no news. It's been around for more than a year now, and contrary to the original thought that it will work its way out with maybe one or two waves, maybe by the end of the year 2020, we now have a fresh and a reinvigorated wave which may last God knows how long, maybe definitely for a few months, maybe even a year. And so it still very much is taking the center stage of our thought across the world and more so in India. But sadly, uh, not just in India, not just in Bangalore or Karnataka, across the world, the response of humanity has been one of panic, which really is harming everybody. What we really have to do is to have clear facts about us. And when we do not have facts, acknowledge the fact that we do not have facts and keep our blind beliefs to a minimum. A belief is what gives rise to myths and misconceptions. But facts, scientific facts as it were, will allay these fears, these misconceptions, and will give humanity the best chance of fighting this very terrible war. There is no doubt that it is a warlike situation. A lot of things are weighed against humanity. No gainsaying that. But only scientific facts will help us fight it. If we continue the way we are doing with beliefs and myths, doing a lot of irrational things that we are doing today, then we'll end up with greater damage to humanity. The reality of COVID is very, very simple. These are facts which are incontrovertible. There is no controversy about this. 40% are asymptomatic, which makes it very easy for it to spread. The healthy man sitting in front of you may be COVID positive. And that is the downside of it. The good side of it is that even though you have a disease, you don't even know that you have the disease. But that for an epidemiologist who is worried about the spread of the disease, this 40% asymptomatic number is a double edged sword. If you are symptomatic, the other 60% who may be symptomatic, it's just like a mild flu. It's like anybody having a little bit of a headache, uh, a little bit of sore throat, maybe a bit of cough, and very few people have moderate to severe disease, which will disable them a little bit more in terms of dropping oxygen levels and extreme fatigue. And perhaps 5% or 3% will need ICU care and higher end of supportive care for very severe disease. And it's a small number. And some of them, in fact, while most of the people who go to ICU honestly don't come out of it, some of them do, perhaps 40% come out. And if the overall figures, if you look at it, only about 1 or 1.5% die. The truth is a little more, truth is that the mortality or the death rate is a little more for the elderly. But this is overall world figures. In India, the mortality is actually lower in terms of percentage of people affected when compared to the world standards, world data. All right. I talked about having a reaction based on scientific outlook and scientific facts. So it's probably worth recapping what we mean by science. Anything that is believed as a scientific fact goes through clinical trials. Okay. The very first phase is what's called a preclinical trial, which involves discovery of a drug in a lab and perhaps some animal experiments if required. The clinical trials are the ones which are done on human beings. The very first phase is on a small number of healthy volunteers. Note, they're not patients. Healthy people who volunteer to do research, and they look at the dosage and the possible toxicity of the drug in human beings. And once it is established that it is okay in healthy volunteers, a phase two trial takes place, which is in a modest number of about 100 to 300 patients. These are patients with the given disease. The medicine is exhibited to them, and then they will know whether the medicine is effective or not. And they also have further gather further information about the possible side effects of the drugs and confirm that the dosage is okay. But mind you, At phase 2, it is still in an experimental stage. Once it is known that this is effective in human beings for a given disease, the drug goes on to the phase 3 of the trial, where a large number of people with the disease are tested on. A lot of data is collected, and when it is found to be effective in this large number of patients, only then it comes for review by statutory bodies. It is the FDA in the United States, it is the drug controller of India in India. So results from phase 3 trials go to uh, the certifying authority, and only then it is used for common use. Now obviously you can see the time it takes for all this. For a pandemic, people very correctly have reduced the shortages. They have also reduced the numbers that I have mentioned here, just to speed things up. And so whatever we go by, whenever we say some medicine is useful, it is life saving, it is not life saving, it is useless or whatever, or it is safe, whenever something like that statement has to be made, we must know that it is certified by the certifying authorities and has gone through successful phase 3. Phase 4, of course, is post marketing. Sometimes, even after all these things, they keep collecting data after its use in a larger number of population. If there is something amiss, then you have obviously heard of certain drugs being withdrawn. So that may also happen. But for us, in the context of today's discussion, the drugs that are known to be useful must have successfully gone through phase 3 trials. Now, if you look at that kind of a scientific outlook for COVID treatment, one of the big phase 3 trials that came out and gave data late last year was a trial called the recovery trial. Now, you don't even have to know all these names and all that, but you will see that the two main classes of drugs that are used against COVID are antiviral medication and things that increase your immunity or modify your immunity to help you fight the viral disease. All right. So in the antiviral treatment, there are many, many drugs that are used: lopinavir, ritonavir, and things like that. Hydroxychloroquine gave a very, very big, made a big bash in the beginning of the COVID pandemic early last year. We talk about convalescent plasma, which is known to supposed to have killed the, plasma, that is antibodies from people who have already suffered from COVID. If you take that plasma and the blood component and give it to patients with COVID, the thought was that that would help them. Dexamethasone is a steroid tablet or an injection that reduces the inflammatory response. COVID is known to give what is called an immune storm. It's called a cytokine storm, where there is an exaggerated immune reaction to the virus, and that sometimes kills patients. And so, to overcome that, you can give steroids. Antibiotics have been used. These are called monoclonal antibodies. They are the modern brahmastras, if you call them that. It's used in cancer, it's used in many other viral diseases. So tocilizumab is one of the it's one of the monoclonal antibodies that has been touted to be useful in COVID. These, I have just given you a list of the medications and the interventions, and we actually look at the data. All right. So to make this graph simple for you, if something works, the top one and the bottom one must be far apart. If they are close to each other, it means that the medicine does not work. These are comparisons of outcomes between giving the medicine and not giving the medicine. Okay. So you can see that these two graphs are so close to each other, essentially means that hydroxychloroquine does not work. As you keep seeing the data that I'm going to show you, you will feel very, very disappointed. Let me tell you that. You will be very disappointed, but that is a fact. The fact is that most medicines for COVID do not work. What about remdesivir? It has been shown as the wonder drug, the life-saving drug. We are hearing about the acute shortage of remdesivir, which has actually caused a lot of panic in the world. So also plasma, because we keep getting in WhatsApp and other social media desperate request for plasma. No, plasma doesn't work. Remdesivir works in terms of a little bit in terms of shortening the duration of the disease. Please remember this. It has no effect on mortality. Do you see what I mean? If you give a medicine, it's not a life saving drug. It does not reduce the number of people who die once they get COVID. The number is very small. I told you 1.5%. Remdesivir does not reduce mortality. It does not reduce the death rate. It only shortens instead of somebody running a disease for 14 days or 16 days, it will reduce it to 12 days. But what do I want? How does it matter to me if I have the disease for 4 days longer? It doesn't. As a patient, I wanted to reduce my risk of death, and remdesivir does not do that. Okay, this is the important message. That you can see the distance between these two. I told you, have these things. Remember, so look at this distance is a little more on the right upper corner of the four graphs, and you'll find that is invasive mechanical ventilation. If somebody is not getting better with oxygen or what we call a BiPAP, an increased level of oxygen, if you use mechanical ventilation, yes, it helps them only marginally, only marginally. Even now, even for patients on ventilators or with COVID pneumonia, the mortality is running around 60% in our country. Okay, only 40% survive. So please understand, for any other disease, for example, you have an injury after a road traffic accident, you get a pneumonia, or after an operation, you get a non-COVID pneumonia. You put them on a ventilator, the mortality is 20% at the most, maximum 25 maybe. But here it is 60%. So you have to understand that even with ventilation, the the advance or the advantage you have in a COVID pneumonia situation, a very ill patient, is marginal. All right. But what has shown is that dexamethasone, the steroid, has reduced deaths by 30%. That is a significant reduction in patients receiving ventilation. So if you have a ventilator, that helps you a little bit. If you add steroids to these people, it helps you even further. It reduces deaths by about 20% in patients who are receiving oxygen but without ventilation. So the sicker you are, the more effective the steroid is. That is the message that we have to know. And it did not reduce mortality, not receiving respiratory support at randomization. If nobody needed any support, that is early cases who get their oxygen up with a little bit of nose oxygen, they don't even need steroids. So the message is actually very, very clear. So to summarize all the data from this very good phase 3 completed recovery trial, remdesivir is generally helpful. At this point in time, another trial result was awaited called Solidarity. We now have the results that it has reiterated. WHO has quoted it very extensively. The Solidarity trial that has said that remdesivir does help with moderate to severe disease in terms of reduction of the duration of symptoms. Dexamethasone continues to help. And please note, no benefit from hydroxychloroquine, other antibiotics, monoclonal antibodies. At that point in time, it said awaited, but solidarity trial has since come, and I'm going to show that also. None of these things like azithromycin, convalescent plasma, other immunomodulators, all of them do not help the patient. Based on this, I saw an article by Dr. Zarir Udwadia in TOI some months ago, and extremely clearly he mentioned for lay persons in a newspaper that please understand, majority of patients get well without any treatment. The immune system will mount its own defense. But what has happened is that physicians and institutions are compelled to prescribe medications because the patients expect it. If you come to me as a doctor and say, look, I think you should take paracetamol and stay home, nobody will like me. Okay, the more expensive prescription I give, the better physician I am. And that is the sad state of affairs. So what happens is that he calls it a self-fulfilling prophecy. As with other bad habits, note the name, as with other bad habits during the pandemic, now is a good time to break it once for all. Don't use unnecessary medication. And that's the message for the doctors and for the patients. Don't demand medication from doctors. Believe their professionalism and please go by what they say. I told you about the other big trial, which is extremely important, which is about the solidarity, which is called the solidarity trial conducted and supervised by the World Health Organization. They very clearly said that mortality and need for ventilation does not depend on remdesivir, hydroxychloroquine, interferon, and other antiviral drugs. Very clearly proved what the recovery trial said. So far, only corticosteroids have been proved to be effective against severe and critical COVID. There is another phenomenon in people with COVID. They do have excessive clotting tendency. I have not quoted those trials, but there is evidence from other trials that using anticoagulation, a drug called heparin, low molecular weight heparin is something that we use, along with steroids, use of heparin and its related compound does help in people with moderate to severe disease. Again, yet another trial conducted by ICMR, Indian organization. No effect of plasma. They have announced it so many times, so many months ago. We still see demand for plasma. And what really we should be worried about, we shouldn't break our head about non-existent drugs which actually are not very useful. It's not going to make a big difference. Rather, we must know about what we can do to reduce the spread, perhaps reduce the severity. Reduce the spread, use masks, distancing, and isolation. Reduce severity, vaccinate. These are two clearly established facts, and I'm going to show you some data for this. This is a droplet infection. There is some controversy as to whether COVID virus floats around in the air, and when you keep inhaling, whether you get it or not. It is not doesn't work like that. It doesn't float around in the air. It's mostly by droplet, and when you're talking, it lasts or spreads about 1.5 meters. That's why the standard recommendation: don't stand closer than 6 feet, about 2 meters from anybody else, and keep talking. Okay, use a mask so that the further spread of the um, droplet infection of the virus, which can go for quite a long distance, well beyond 2 meters, does not occur. And of course, if you sneeze, it can go up to 8 meters, 24, 25 feet. So when you squeeze, do it into your hand and sanitize your hand afterwards. Do not squeeze, sneeze or cough out into the open air, because the droplet can go a long distance. It's very simple. If you want to avoid transmission, use masks. There are various specifications for masks, and I won't go into the detail. I don't think it's important, but a 3-layered cloth mask is good enough. Keep a distance of at least 2 meters. Keep washing your hands. And if you have the slightest of symptoms, whether you're COVID positive or not, stay home. Don't go out. And please note that you're doing all this to protect somebody else. You've already perhaps got COVID, we never know, but all these things are designed to protect others. So even if you're very strict with your mask wearing, distancing, and washing, if your friend is indisciplined, he comes and stands next to you. He comes and doesn't wear a mask, or wears a mask improperly, which is a lot more common. I see everybody either with their nose exposed or with their mouth exposed, with the mask under the chin. And what is the purpose of that? It must be a properly worn mask which covers both the nose and the mouth nicely. And if that is done properly, then isolation and spread will contain itself. And I urge all of you, if you find somebody, even a layperson, even a stranger, not doing it in public, kindly ask him to do that. Please ask them to wear a mask before they come out. It's very important. Now, the next few slides, I'm going to talk a little bit about what we do in the hospital, because, well, I don't need to go into the details, but But you need to know if you have to go to a hospital for COVID or for a non COVID hospital, the kind of treatment you're going to get in that hospital can sometimes be irritating and you may even find it offensive. Okay, it's not like walking into a hospital on a normal day. We are in a war like situation. I'm trying to tell you what we do from our perspective as a doctor and a healthcare worker so that you understand why people seem to be rude or they may seem to be overly rigid with their rules when you walk into a hospital. We understand that when you come to a hospital, instead of going to a movie house, that you're distressed with something. Otherwise, nobody goes to a hospital. So we want to be kind to you. But being kind and being careless are two different things. We have to be careful. At the same time, we have to be kind. And that's where your understanding is very important. That's why I'm going to spend a few minutes. We understand that the patient, when he has a surgical condition, comes with risks because of surgery, risks to the family. They need family support. And we understand there are big emotional issues. And also note from our side, as a surgeon, I am a surgeon. So I'm responsible for my whole team and my whole hospital, nursing staff, support staff. So we need to be first right and healthy for us to extend treatment to you. If we are careless and if half of our workforce or two-thirds of our workforce falls ill, then there is nobody to see you or treat you. So these are very, very important. To do that, we screen you, we hold you in an intermediate area, and we separate the COVID and the non-COVID stream. So the first problem you face is entry restrictions. We don't allow your friends and relatives to come in. We insist that only the patient come in, and if the patient cannot support himself or herself, cannot explain his symptoms, there are some frail, elderly, various reasons they cannot explain themselves. We allow only one attendant to come so that they can communicate with the doctor. In an emergency, when we do not know whether you are a COVID positive or a negative patient, we hold you in a holding area, which is not like a regular ward. It is not as comfortable as a regular ward, but still you have to be there. It's like a general ward. And then we separate the flow. You know, we keep COVID and non-COVID patients separate, and they're on different floors. And the entry of a suspected COVID patient is from the side, not from the main door. And so we take a undertaking from you at the gate as to whether you have a fever, cough, or fatigue. And if you say I have a fever, we put you elsewhere. And somebody else, you may see somebody else walking into the main door to the main reception. These are people who do not have those symptoms. And we screen, as I told you, at the very gate. And mind you, this is me getting into the hospital. My temperature is checked every time I get into the hospital, and I have my hands sanitized. So is a protected nurse. And when it comes to needing surgery, if the patient has COVID, then the risks of surgery are 5 to 10 times higher. So we do not do even if you have you know short of a life-threatening emergency surgical condition, if you have COVID, we do not operate on you. We ask you to go away for 2 to 3 weeks and then come back. And so to know that, we told you 40% are asymptomatic. So when you come to me with a surgical condition, a hernia or a gallstone or whatever else, we ask all patients to have a COVID test done. Some people don't like it. I said, I have nothing. Why are you asking me? I tell them, look, 40% are asymptomatic. I'm doing it to protect you. Of course, I'll protect myself in the way, because when I'm dealing with a COVID positive patient who may be asymptomatic, I'm exposing myself. And so when the patient becomes positive, you use temporizing measures, just give them painkillers, antibiotics, ask them to wait. We do not deal with the specific problem. And the sobering thought, science again, fact again, is that RT-PCR test is false negative in 20%. It means that even though the patient may have COVID, in 20% of cases, it comes back as negative, not because the lab is stupid or the doctor doesn't know what he's doing everything correctly. The limitation of the test is a false negative of 20%. Similarly, false positive is 5%. When you don't have COVID, the test may say you have COVID 5% of the time. Okay, that patient will be harmed because we take decisions based on the test report, but we know it, but we can't do anything better than that. There is a rapid antigen test that goes with it. RT-PCR takes 1 to 3 days for the report to come. This antigen test comes within half an hour, the result, but it has a higher false negative rate. We still don't have a data on what its false positive rate is. So I put a question mark on that. And so we come to perhaps what is most important for the audience today, which is the emotional and family issues. We counsel them. We counsel them a lot. We send them information on email and WhatsApp and things like that for them to understand, whatever that I have said now. We really do make a sincere attempt to communicate with them, and not in any way a small issue is a financial issue. With the kind of care that we have to take, the costs go up a lot. The disposable costs, where we use and throw things because we can't reuse them because of fear of infection, costs really go up. And when staff come in to support, they are in the hospital. They have to be fed and looked after. They can't walk in and out of the hospital like on ordinary days. And so please note that the care of COVID care, of COVID patients really goes up a lot. And I'll run through this because it's not very essential for you. We do use three levels of protection for healthcare workers. This is the basic step where we don't use our street clothes. I walk in with my street clothes, change over to greens, wear an N95 mask and a visor. That is the basic one. The intermediate one will have the same things plus specific shoes and another gown, disposable gown, which we throw away. And this is how I do my clinic today. It's not neither comfortable for me nor good for the patient, but with so much COVID around, we have no choice. We use a full PPE, foot cover, we're covered from head to toe completely, with a double protection for the masks, and everything is completely covered, along with my gloves. And so you find that the communication with the doctor, with very little eye contact, perhaps not being heard properly because of the mask, is less than optimal. We understand that, but we have to do this because we have to protect ourselves. Because any person who walks in, whether he is tested positive or negative, is potentially considered to be COVID positive. This is us doing an endoscopy. Believe you me, it is extremely uncomfortable to do even 1 hour of outpatients like this, 1 or 1.5 hours. But we sometimes spend several hours a day doing our work there. And our surgical team uses, not just an N95 mask, but a respirator, which these pink things are special filters. So it's not just me here, but my whole team, which has to have this. And over this, if there is a COVID positive patient, we try to avoid surgery, but there are certain life threatening surgical conditions where you cannot not operate. So we use this. This is the full PPE, and it's a very uncomfortable process for the surgeon himself. But we are donned like this when we operate on COVID patients. There was a big worry or a fear about laparoscopy, but it is now known that laparoscopy does not carry any extra demons or extra risks, as it were. So if necessary, we will do laparoscopy also. But then I sort of skimmed through the operations because it's not highly relevant to today's topic. But we need to know a bit about vaccines because there's a lot of myth, a lot of misinformation about vaccines. So whatever I say is proven, is through phase 3 trials, as I told you. These percentages I quote are approximations. They're not exact figures, but in the same range. I may be wrong by maybe 5% at the most. Vaccines are safe. You need not have any worries about that. You get about 50% immunity after the first dose. And after the second dose, initially they said it must be 4 weeks. They have now extended it to 6 to 8 weeks. So you can take it anywhere between 4 and 8 weeks. When you do that, the level of protection will be about 70 to 80%, which means that 100% protection is not to be expected from vaccines. So there is a lot of palabra made about some minister, some VIP who had who had uh, sorry, I don't know why I skipped. So yeah, who had vaccine but still got COVID positivity, still got a COVID infection. For a doctor, it is not surprising at all. So many of us, in spite of having vaccines, may end up getting the disease. And we still don't know completely clearly how long that safety of the vaccine lasts. It may be anywhere between 6 to 12 months, and over the next 2 to 3 months, we should be able to get some good data. You must have heard about clotting that occurs with some of these vaccines. And so you find Europe banning the Pfizer vaccine from America and somebody else raising doubts in India also. This fear of clotting is unfounded. I think it is more political and business related conflict rather than scientific conflict. Availability is always an issue. We have such a large population. Now that they have opened it for 18 plus as well from 1st May, availability will be an issue. So we just have to wait it out and see how the system copes with this difficulty. Now, most people have mild disease, 90%, 92%. What you will have is some fever, not all of them, but some of them, fever, body ache, fatigue, loss of taste, loss of appetite, loss of smell, sometimes diarrhea. If your respiratory rate is less than 25 minutes, 25 cycles per minute, and if your saturation is more than 90, if you're a young healthy person or a normally healthy person, do not worry. If you have underlying heart or lung disease, or you had a stroke, or if you have a kidney failure and things like that, your saturation must be 94. If it's below 94, then you'll have to need you need hospitalization and hospital care. But by and large, for the large majority of population who is generally healthy, you can wait at home with COVID disease, even if you're positive, without any panic. Stay at home, on breathe normally, stay at home, and you will get better in 10 to 15 days. There is no doubt about it. Large majority, 90% go like that. And for safety, keep checking your respiratory rate, that is the number of times you breathe in a minute, and check your saturation. These pulse oximeters are available. They cost around 1,000 rupees hand, that thing that clips onto your hand, the contraption, and you can check it 2 to 3 times a day. Make sure that you don't get dehydrated. Drink a lot of fluids. Remember, you won't have appetite, so you may not be able to eat well. But if you don't eat well, it doesn't matter for a few days, but you cannot afford to get dehydrated. Take rest, and if you have fever and body ache, take paracetamol. Dolo is a common trade name, crocin, things like that. So take paracetamol, and that is all you need. Now, if you go beyond that, saturation below 90, respiratory rate more than 25, you have symptoms, you need hospitalization. But is this what's happening today? Sadly, no. The myths far outnumber the scientific data that I have outlined to you. As I said, I won't go into the details. The myth starts from the fact somebody is saying COVID is just is a concoction of some pharmaceutical companies. They don't even agree that something like COVID exists. They feel that it is a concoction of Bill Gates, for example, because he has shares in the company that makes remdesivir. And Miss Muller mentioned about having something put into your nose, the lemon juice. Okay, you even have our national health minister endorsing a product which has not been put through the rigors of the different phases of trial that I mentioned to you. There are fears that doctors are actually killing patients in hospitals, so people don't want to go to hospitals. There are fears that there are bad side effects of the vaccines, and that vaccines are pushed by our prime minister to poison a whole lot of people in the population. So, I mean, if I keep listing the myths that are running around, it's maddening. So I won't go into the details, but I would like to say two or three things. Okay, what I call WhatsApp University, the nonsense that is forwarded several times in WhatsApp groups has to stop. It won't stop. So my appeal to each one of you, young students and teachers who are the cream of society, don't look at it. If you look at it, don't take it at face value. The sensationalism in our TV news must stop. When they show all these, I'm not saying those things are not happening, but that's a minority. People dying on the streets with oxygen cylinders in auto rickshaws, under the tree, and this and that, I mean, but they're forgetting about the 90% who are getting better. And so if I get COVID tomorrow, I get panicky, and creating a panic in the population is a great disservice. And they're also not, they only talk about doctors doing this bad, doing that bad, hospitals fleecing somebody. I'm not saying it's not happening at all. It is, but it is happening in a very small percentage. The large majority of medical institutions and doctors are working and nurses, it's not just doctors, mind you, nurses, paramedical staff. It needs a lot of commitment, honesty, and hard work to get the system going. And contrary to what the newspapers and television say, I don't think the health system has collapsed. Lots of people, thousands of people are being helped. There are a few who are losing out. I'm not saying no, and my heart goes out to them. But the reality is, a large number are being helped, and only negative reporting doesn't help. It's bad for everybody. This panic is actually making the situation worse for all of us. It's making it worse for the patients primarily. It's making it worse for the hospitals and the healthcare sector, and it's making things worse for the government. It's blocking beds. I hear any number of people, the moment they know that they have COVID positivity, they want to block a bed. They want to come and be in a bed in a hospital with oxygen in anticipation of them becoming worse. Only 5% become worse. I have told you very clearly. 95%, if everybody wants a bed in a hospital, you will only have hospitals and no houses in the country. So, what you have to do is, these healthy people who do not need oxygen are blocking the beds, bulldozing their way into the hospital, so that the guy who really genuinely needs it doesn't have a bed. That's a sadness. Same thing about artificial shortage. Everybody, people come and demand that we give them remdesivir. They demand that we give them plasma, demand that we give them tocilizumab. Now, how will you get those drugs? Those who really need it don't get it. And it's putting such a lot of pressure on healthcare workers all over. When you're working your guts out, you're working very hard, sincerely, you are not only not thanked, forget about being thanked, you're actually abused. You're told that you're cheating them. And that really hits the basis of human relationship. And when that happens, there's bound to be a healthcare worker burnout, and that's not good for the system. So what I would like to say is that we are going through very difficult times. It'll continue for months, and it's good that all of us introspect, and it calls for a lot of understanding and emotional resilience on the part of everybody: patients, sufferers, doctors, nurses, administrators, the government. It needs a degree of resilience. We should not bring politics, we should not play the blame game. Rather, put the shoulders to the wheel, all of us as one unit, so that we win this war. It's not that we are all fighting each other. All of us must sit together and fight Corona. Thank you very much for your patient listening, and I'll be happy to take your questions.
Thank you, sir, for your extensive explanation about the pandemic which we are all undergoing. Now, I request any one of the audience who are there in Zoom to ask any one question, please. If you have any doubts, so please clarify. Then I'll take up the questions from audience. Principal sir, or Kirtan sir, or Madam Sugami Madam, welcome to the show.
Good afternoon, Sugami. You're muted.
Yes, please. If you can have any doubts, you can clarify with the doctors. Then I'll take up the questions from the audience. ಸರ್, ಸುಮಾರು ಜನ ನಮ್ಮಲ್ಲಿ ಪೇರೆಂಟ್ಸ್ ಇರೋದ್ರಿಂದ ಐ ವುಡ್ ಲೈಕ್ ಟು ಆಸ್ಕ್ ಕ್ವೆಶ್ಚನ್ಸ್ ಇನ್ ಕನ್ನಡ ಆಲ್ಸೋ. ಯಾಕೆಂದ್ರೆ ಅವ್ರಿಗೂ ಸ್ವಲ್ಪ ಕ್ಲಾರಿಫಿಕೇಶನ್ ಸಿಗ್ಲಿ ಅಂತ. ಧಾರಾಳವಾಗಿ ಸರ್. ಯಾಕೆಂದ್ರೆ ಈಗ ಮಿಸ್ಕನ್ಸೆಪ್ಷನ್ಸ್ ಅಂತ ನಾವ್ ಯಾಕೆ ಈ ಟಾಪಿಕ್ ಅನ್ನ ಇಟ್ವಿ ಅಂದ್ರೆ, ಸೊ ನೀವು ಈಗಲೇ ಹೇಳ್ದಂಗೆ ದೇರ್ ಆರ್ ಲಾಟ್ ಆಫ್ ಮಿತ್ಸ್. ಅಲ್ಲಿ ಫ್ಯಾಕ್ಟ್ಸ್ ಗಿಂತ ನಮಗೆ ಸಿಗ್ತಾ ಇರೋ ಇನ್ಫಾರ್ಮೇಶನ್, ವಾಟ್ ದ ಇನ್ಫಾರ್ಮೇಶನ್ ದಟ್ ವಿ ಆರ್ ಗೆಟಿಂಗ್ is more of a false information ಇರಬಹುದು, because they are mainly relying on social medias as well as the electronic media. The first question, which mask to wear? Because the cotton mask ಹಾಕೊಂಡ್ರೆ ಎಫೆಕ್ಟ್ ಇರಲ್ಲ, ಅಥವಾ ಸರ್ಜಿಕಲ್ ಮಾಸ್ಕ್ ಹಾಕೊಂಡ್ರೆ ನಂತರ ಪ್ರಾಬ್ಲಮ್, ಆರ್ N95 ಮಾಸ್ಕ್ ಹಾಕೊಂಡ್ರೆ is the best. So is it a lobby ಅಥವಾ which mask to wear according to you?
3-layer cloth mask is what is recommended for general use.
Okay. So not necessarily
N95 bekagilla. That is for people in hospitals who have a concentrated exposure to people with possible N95. Lay persons, 3-layer cloth mask is adequate.
The second thing is splitlets ಇಂದ ನಾವು ಸ್ಪ್ರೆಡ್ ಆಗುತ್ತೆ ಅಂದ್ರೆ 6 meters ದೂರ ಇದ್ರೆ ಸ್ಪ್ರೆಡ್ ಆಗಲ್ಲ ಅನ್ನೋದು is the one information. Nowadays we are getting information that it is spreading through air ಅನ್ನೋದು.
ಹೌದು.
So how far it is true?
ಏರಲ್ಲಿ ಆಗತ್ತೆ ಅನ್ನೋದು ಬಹಳ ಬಹಳ ಅಪರೂಪ. I cannot say it will never happen, to be honest, but the large majority of transmission occurs if you are within 2 meters from a person who has COVID and you have an exposure for something like 10 minutes. Please note that if you are standing, if you stand next to a person with a COVID and say, hi, good morning, nice seeing you, and walk away after 30 seconds, you will not get COVID. It needs not only a short distance, but also a considerable amount of time, and that is now considered to be 10 minutes.
Next thing is, what is the difference between a normal flu and a flu for a COVID patient? ಅಥವಾ ಕೋವಿಡ್ ಪಾಸಿಟಿವ್ ಬಂದಿರೋನ್ಗೆ ಫ್ಲೂ ಅಥವಾ ಜ್ವರ ಬಂದಾಗ ಏನ್ ತರ ಸಿಂಪ್ಟಮ್ಸ್ ಇರುತ್ತೆ, ಅಥವಾ ನಾರ್ಮಲ್ ಫ್ಲೂ ಮತ್ತೆ ಜ್ವರ ಬಂದಾಗ ಏನ್ ಸಿಂಪ್ಟಮ್ಸ್ ಇರುತ್ತೆ?
Flu ಅನ್ನೋದು it is a lay person's term for influenza, which is one kind of virus. COVID is coronavirus. It's a different kind of virus, but what kills people with this, is the pneumonia or the lung infection that both influenza and corona give. Influenza seems to be on the wane compared to the 1920 pandemic that happened with influenza. It has changed over a lot of time. So influenza is not as dangerous as corona pneumonia. COVID pneumonia is dangerous, and it causes causes a much higher mortality than an influenza pneumonia. And the real difference is that influenza has been around for a long time. So most of us have immunity against it innately. Whatever modalinda we have built in immunity for that. Only the elderly now they recommend that influenza vaccine every year. But corona is a relatively new disease which has mutated. The virus has mutated and it's a new disease. And so nobody in the humanity is protected against it. And of course, corona will become like influenza in the next 30-40 years.
Okay, sir, recently I heard one thing. One of my relative iranta uralle agidanta incident idu. When people went there to give the vaccinations, the entire village people, they refused it. The reason is ತಗೊಂಡ್ರೆ ಸತ್ತೋಗ್ಬಿಡ್ತಾರೆ ಅಂತ ಒಂದು ಮಿತ್ ಸ್ಪ್ರೆಡ್ ಆಗಿದೆ. Then second thing is, ಅದಕ್ಕೆ ಸಪೋರ್ಟ್ ಮಾಡೋ ತರ ಏನಾಗ್ತದೆ, ವ್ಯಾಕ್ಸಿನೇಷನ್ ತಗೊಂಡವ್ರಿಗೆ ಮೆನಿ ಆಫ್ ದ ಪೀಪಲ್ ದೇ ಆರ್ ಸಫರಿಂಗ್ ಫ್ರಮ್ ಬಾಡಿ ಪೇನ್, ಜ್ವರ ಬಂದಿರೋದು, ಈ ತರದೆಲ್ಲ ಆಗ್ತಾ ಇದೆ. Is it not affecting the vaccination process?
Yeah, you see, ಇಂಜೆಕ್ಷನ್ ಕೊಟ್ಟ ಕಡೆ ಸ್ವಲ್ಪ ನೋವು ಬರೋದು, ಮೈಲ್ಡ್ ಫೀವರ್ ಬರೋದು, ಮೈ ಕೈ ನೋವು ಬರೋದು ಒಂದು 3-4 ದಿನಕ್ಕೆ, it is not a side effect of the vaccine. It is a part of the vaccination process. Please note that vaccine is a small dose of the virus, not a live virus. There are different mechanisms for vaccines. I won't go into it, but the doctors or the healthcare industry is exposing the person who is vaccinated to a corona-like situation in a very small manner, so that the body understands the antigens and produces antibodies. Antibodies are proteins that fight the infection. So next time when the actual corona comes, the body is prepared for it. So it is normal for somebody to have a mild reaction with a vaccine. That definitely does not kill the patient. ಎಲ್ಲಿ ಪ್ರಾಬ್ಲಮ್ ಬಂದಿರೋದು ಅಂದ್ರೆ ಪೀಪಲ್ ಕೀಪ್ ಡೈಯಿಂಗ್ ಫಾರ್ ವೇರಿಯಸ್ ರೀಸನ್ಸ್ ಅದರ್ ದ್ಯಾನ್ ದಿ ವ್ಯಾಕ್ಸಿನ್. Okay, and coincidentally after a few hours of after giving a vaccine or a day after taking the vaccine, somebody dies for some other reason, and people attribute it to that particular event of vaccination, and that is incorrect. When I say vaccine is found to be safe, you saw a thing, it has been tested on thousands of people, and then they have known that the side effects or the death rate from that vaccine is no more than people without vaccines, which means that that event, that big side effect, stroke for example, or a heart attack or death or whatever, cannot be attributed to the vaccine.
ಸರ್ ಎಲ್ಲ ಕಡೆ ಮೇನ್ ಟೆಸ್ಟ್ ಮಾಡ್ತಾ ಇರೋದು ಟೆಂಪರೇಚರ್. ಓಕೆ, ಈಗ ನಾವು ಕೇಳ್ತಾ ಇರೋ ಪ್ರಕಾರ ಈವನ್ ಜ್ವರನೂ ಬಂದಿರಲ್ಲ, ಬಟ್ ಕೋವಿಡ್ ಪಾಸಿಟಿವ್ಸ್ ಇರುತ್ತೆ ಅಂತ. ಜಸ್ಟ್ ಟೆಂಪರೇಚರ್ ಚೆಕ್ ಮಾಡಿ ಒಳಗ್ ಬಿಡೋದ್ರಿಂದ, ಅಂದ್ರೆ ಅದರ್ ದನ್ ದಟ್ ಆಕ್ಸಿಮೀಟರ್ ನೇ ಚೆಕ್ ಮಾಡಿ ಒಳಗ್ ಬಿಡಬಹುದಲ್ವಾ? ಬರೀ ಯಾಕೆ ಟೆಂಪರೇಚರ್ ಮಾತ್ರ ಇಟ್ಕೊಂಡು ಇದ್ ಮಾಡ್ತಾ ಇದ್ದಾರೆ? ಇಸ್ ದಿಸ್ ದ ಓನ್ಲಿ ಪ್ಯಾರಾಮೀಟರ್ ಟು ಟೆಸ್ಟ್ ದಿ ಹೆಲ್ದಿನೆಸ್ ಆಫ್ ದಿ ಪೀಪಲ್?
ಇಲ್ಲ, ಸಿ, ಆಕ್ಸಿನೇಷನ್ ಕಮ್ಮಿ ಆಗೋದೇ ಇಲ್ಲ ಇವರಿಗೆ. ಎಸಿಂಪ್ಟೊಮ್ಯಾಟಿಕ್ ಪೇಷಂಟ್ಸ್ ಆರ್ ಎಸಿಂಪ್ಟೊಮ್ಯಾಟಿಕ್ ಅಂದ್ರೆ ಸಿಂಪ್ಟಮ್ ಇಲ್ಲದೆ ಇರೋರು, ಅವ್ರಿಗೆ ಜ್ವರನೂ ಇರಲ್ಲ, ಮೈಕೈ ನೋವು ಇರೋದಿಲ್ಲ, ಆಕ್ಸಿಜನ್ ಕಮ್ಮಿ ಇರಲ್ಲ, ಎಲ್ಲ ನಾರ್ಮಲ್ ಆಗಿರುತ್ತೆ. ಟೆಸ್ಟ್ ಮಾಡಿದ್ರೆ ಅವ್ರು ಪಾಸಿಟಿವ್. ಅದಕ್ಕೆ ನಾವು ವಿ ಕ್ಯಾನ್ ನೆವರ್ ಸ್ಕ್ರೀನ್ ಪೀಪಲ್, ಎಸಿಂಪ್ಟೊಮ್ಯಾಟಿಕ್ ಪೀಪಲ್. ಅವ್ರಿಗೆ ನೀವು ಏನಾರು ಹಾಕಿ ಅವ್ರಿಗೆ ನೀವು ಟೆಸ್ಟ್ ಮಾಡಿದ್ರೇನೆ ಗೊತ್ತಾಗೋದು. ಸೊ ಯು ಕ್ಯಾನ್ ನಾಟ್ ಸೇ ಐ ವಿಲ್ ಡೂ ಎ ಕೋವಿಡ್ ಟೆಸ್ಟ್ ಆನ್ ಯು ಬಿಫೋರ್ ಯು ವಾಕ್ ಇನ್ ಟು ದ ಹಾಸ್ಪಿಟಲ್. ಇಟ್ಸ್ ಅನ್ ಇಂಪಾಸಿಬಿಲಿಟಿ. ದಟ್ ಈಸ್ ವೈ ಐ ಶೋಡ್ ಯು ದಟ್ ಪಿಕ್ಚರ್ ವೇರ್ ವಿ ಪ್ರೆಸ್ಯೂಮ್ ಎವ್ರಿಬಡಿ ಇಸ್ ಪಾಸಿಟಿವ್. ಅದಕ್ಕೆ ಆ ತರ ಗೊಗ್ಗಾಯ ತರ ಇರೋ ಪಿ ಎಲ್ಲ ಹಾಕೊಂಡು ಮೇಲಿಂದ ಕೆಳಗಿನ ತನಕ ಕೂತ್ಕೊಳ್ತೀವಿ. ಸೋ ಅನ್ಕಂಫರ್ಟಬಲ್, ಬಟ್ ದಟ್ ಇಸ್ ಹೌ ವಿ ರನ್ ಅವರ್ ಔಟ್ ಪೇಷಂಟ್ಸ್. ಬಿಕಾಸ್ ಆಲ್ ದ ಪೀಪಲ್, ಇಫ್ ಯು ಕಮ್ ಟು ಅವರ್ ಔಟ್ ಪೇಷಂಟ್ಸ್ ಟುಡೇ ಇನ್ ಆ ಹಾಸ್ಪಿಟಲ್, ನಾನು, ನರ್ಸು, ನಮ್ಮ ಅಸಿಸ್ಟೆಂಟ್ಸು, ಲ್ಯಾಬ್ ಟೆಕ್ನಿಷಿಯನ್, ಎಲ್ಲರೂ ಆ ಫ್ಲೋರಲ್ಲಿರೋರು ಎಲ್ಲರೂ ಆ ಥರ ಪಿ ಹಾಕೊಂಡು ಕೂತಿರ್ತೀವಿ. ಬಿಕಾಸ್ ವಿ ಪ್ರೆಸ್ಯೂಮ್ ದಟ್ ಎವ್ರಿಬಡಿ ಹೂ ವಾಕ್ಸ್ ಇನ್ ಈಸ್ ಕೋವಿಡ್ ಪಾಸಿಟಿವ್ ಅಂಟಿಲ್ ಪ್ರೂವ್ಡ್ ಅದರ್ವೈಸ್.
ಸರ್, ಇದು ಕ್ಲಾತ್ ಗಳ ಮೇಲೆ ಸರ್ವೈವ್ ಆಗುತ್ತಾ ವೈರಸ್? ಬಿಕಾಸ್ ಈ ಬಟ್ಟೆಗಳ ಮೇಲೆ ಅಷ್ಟು ಟಚ್ ಮಾಡದೆ ಬರುತ್ತೆ, ಅಥವಾ ರೈಲಿಂಗ್ಸ್ ಅನ್ನ ಟಚ್ ಮಾಡದೆ ಬರುತ್ತೆ. ದೀಸ್ ಆರ್ ಆಲ್ ದಿ ಕನ್ಸೆಪ್ಷನ್ಸ್ ದಟ್ ಪೀಪಲ್.
ಕರೆಕ್ಟ್, ಫಾರ್ ಎ ಫ್ಯೂ ಅವರ್ಸ್ ಇಟ್ಸ್ ಟ್ರೂ. ಸಿ, ಏನಾಗುತ್ತೆ, ಸಪೋಸ್ ಯು ಆರ್ ಕ್ಲೋಸ್ ಟು ಮೀ ವಿತ್ ಆರ್ ವಿತೌಟ್ ಅ ಮಾಸ್ಕ್ ಆರ್ ಯು ಸ್ನೀಸ್, ಪೇಷಂಟ್ಸ್ಗೆ ನೀವು ಕೆಂಬೇಡಿ ಸೀನ್ ಬೇಡಿ ಅಂತ ಹೇಳಕ್ಕಾಗಲ್ಲ. ಸಂಬಡಿ ಕಮ್ಸ್ ದೇರ್ ಪಾಪ, ಆರ್ ಹಿ ಇಸ್ ಆಂಕ್ಷಿಯಸ್, ಶೌಟ್ಸ್ ಅಂಡ್ ಜೋರಾಗಿ ಮಾತಾಡಿದ್ರು, ಏನೋ ಶೌಟ್ಸ್ ಅಂದ್ರೆ ಜೋರಾಗಿ ಮಾತಾಡಿದ್ರು, ಹಾಗೆಲ್ಲ ಮಾಡಿದಾಗ ದೇ ವಿಲ್ ಬಿ ಪುಷಿಂಗ್ ವೈರಸಸ್ ಆನ್ ಮೀ ಆಸ್ ಅ ಡಾಕ್ಟರ್ ಆರ್ ಎನಿ ಅದರ್ ಪರ್ಸನ್ ಸಿಟ್ಟಿಂಗ್ ನೆಕ್ಸ್ಟ್ ಟು ದೆಮ್. ಸೊ ದಟ್ ವೈರಸ್ ವಿಲ್ ಬಿ ಸಿಟ್ಟಿಂಗ್ ಆನ್ ಮೈ ಕ್ಲಾತ್. Okay, but that is not forever. It is guesstimated. This is not any study that has proved, but about 6 hours ಇರಬಹುದು, ಅದಕ್ಕಿಂತ ಜಾಸ್ತಿ ಇರಲ್ಲ ಅಂತ ಹೇಳ್ತಾ ಇದ್ದಾರೆ. Solid data on the duration of survival on cloth or fomite is not available. Okay, but about 6 hours ಅಂತ ಇಟ್ಕೊಳ್ಳಿ. So we don't take a chance. So we don't, ನಾನು ಮನೆಯಿಂದ ಹಾಕೊಂಡು ಹೋಗೋದು ಬಟ್ಟೆ ಇರೋದೇ ಇಲ್ಲ ನಾನು ಆಸ್ಪತ್ರೆಗೆ ಹೋದಾಗ. The first thing I do is I walk into my operation theater changing room. All of us do it. We change to a greens. ಆ ಗ್ರೀನ್ಸ್ ಮೇಲೆ ಇನ್ನೂ ಒಂದು ಲೇಯರ್ ಆ ಪಿ ಇದೆಯಲ್ಲ, ಅದು ಹಾಕೊಂಡಿದ್ದೀವಿ. ಸೊ ಆ ನ ಔಟ್ ಪೇಷಂಟ್ಸ್ ಬಿಡಕ್ ಮುಂಚೆನೆ ಆ ಪಿ ಅಲ್ಲೇ ಡಿಸ್ಕಾರ್ಡ್ ಮಾಡ್ತೀವಿ. ಐದರ್ ಇಟ್ ಈಸ್ ಥ್ರೋನ್ ಅವೇ ಆರ್ ಇಟ್ ಈಸ್ ವಾಶ್ಡ್ ವಿತ್ ಸೋಪ್ ಅಂಡ್ ವಾಟರ್, ಸಮ್ ಆಫ್ ದೆಮ್, ಟು ಕೀಪ್ ದಿ ಕಾಸ್ಟ್ಸ್ ಡೌನ್. And then after the day's work in the hospital, I take away the greens, and that also goes for washing every day. I put on my normal street clothes and then get back home. Yeah.
So a normal person agi sir, say for example me, ಹಿಂಗೆ ನಮ್ಮನ್ನ ನಾವು ಟೆಸ್ಟ್ ಮಾಡ್ಕೊಳ್ಬಹುದು ವೆದರ್. ಈಗಂದ್ರೆ ಈಗ ಆ ಟೆಸ್ಟಿಂಗ್ ಬಗ್ಗೆನೂ there are a lot of question marks now. So ನೀವೇ ಹೇಳಿದ್ರಿ, even ನೆಗೆಟಿವ್ ಬಂದ್ರು ಕೂಡಾನು there is a chances of 40% to be considered as a positive.
20% chance RT-PCR that you could be positive. Yes.
So ಆ ತರ ಇದ್ದಾಗ, ಈಗ say for example as a layman, ಈಗ ಏನು ಸಿಂಪ್ಟಮ್ಸ್ ಇರಲ್ಲ, ಹಿಂಗೆ ನಾವು ಅಥವಾ ಇದನ್ನ ನಾವು ಹೆಂಗೆ ಡೈಲಿ ಮೆಜರ್ಸ್ ತಗೊಳ್ತಾ ಇರಬಹುದು?
ಡೈಲಿ ಮೆಜರ್ಸ್ ನಿಮ್ದು ಮೂರೇನೆ. ಡೋಂಟ್ even think that you may be positive, you may be this, you may be that. As a way of life, social distancing ಇಡಿ, ಮಾಸ್ಕ್ ಹಾಕೊಳ್ಳಿ, ಕೈಯನ್ನ ಫ್ರೀಕ್ವೆಂಟ್ ಆಗಿ ತೊಳ್ಕೊಳ್ಳಿ, and never go into a crowd even if the government doesn't impose a lockout. ನಾನು ಲಾಸ್ಟ್ ಫೆಬ್ರವರಿಯಿಂದ ಯಾವುದಕ್ಕೂ ಸಿನಿಮಾಗೆ, ಹೋಟೆಲ್ಗೆ, ಮದುವೆಗಳು ಕರೆದ್ರು ನಾನು ಫೋನ್ ಮಾಡಿ ವಾಟ್ಸ್ಆ್ಯಪಲ್ಲಿ ಬ್ಲೆಸ್ ಮಾಡಿಬಿಡ್ತೀನಿ. ಐ ಡೋಂಟ್ ಗೋ. ಮದುವೆ ಮಾಡೋದೇ ನನ್ನ ಪ್ರಕಾರ ತಪ್ಪು, ಬಟ್ ಮಾಡೋದು ಮಾಡ್ತಾರೆ. ಐ ಆಮ್ ನಾಟ್ ಗೋಯಿಂಗ್ ಟು ಕ್ವೆಶ್ಚನ್ ದಟ್, ಬಟ್ ಐ ಡೋಂಟ್ ಗೋ. ಯಾರೋ ಗೃಹ ಪ್ರವೇಶಕ್ಕೆ ಏನು ಕರೆದ್ರು ಹೋಗೋದಿಲ್ಲ. ವೆನ್ ಐ ಎಕ್ಸ್ಪೆಕ್ಟ್ ಮೋರ್ ದೆನ್ 5 ಪೀಪಲ್ ಸಮ್ವೇರ್, ಐ ಡೋಂಟ್ ಗೋ. ಅಷ್ಟೇ. ಎಲ್ಲರೂ ಅದನ್ನ ಮಾಡಿದ್ರೆ ಸರ್ಕಾರ ಇದನ್ನ ಇಂಪೋಸ್ ಮಾಡೋಷ್ಟಿಲ್ಲ. ನಮಗ್ ನಾವೇ ಡಿಸಿಪ್ಲಿನ್ ಇಟ್ಕೊಂಡು ಸೆಲ್ಫ್ ಇಂಪೋಸಿಷನ್ ಆಯ್ತು ಅಂದ್ರೆ ಕೊರೋನಾ ವಿಲ್ ಬಿ ಕಂಟ್ರೋಲ್ಡ್.
Here is one question, sir. How far it is true that post-COVID patients blood thickening or heart arrest in post-COVID patients?
Yes, some people do have it, and the good news is that when they have COVID, we always measure them for that particular risk, and we cover them with anticoagulants. Anticoagulants andre blood thinners, so that is very easily treated. It is true that it's not a large number. Some of them are prone to higher clotting than other diseases, and that is constantly monitored by all the doctors who treat COVID patients.
Illi Mr. Chandrasekhar anta, he has asked one question. Sir, is it compulsory that everybody should take vaccine? In my home, my dad has the opinion of taking Ayurvedic treatment rather than vaccine.
Yeah, vaccine is a must. I have no two ways about it. One of my very first slides was the clash between facts, scientific facts, and beliefs. And I have nothing more to say. I have no doubt. I follow scientific facts. I do not follow anything which is a belief. And I believe that Ayurveda is a belief. I'm not in any way putting Ayurveda down, or I'm not saying anything negative about it, but it is not science in the conventional meaning of the term. And so I would recommend that every person who is above 18 must have a vaccine.
I don't know whether to ask this question or not. Somebody asked which vaccine is effective amongst the vaccines.
All of them are effective. Take it from me. You know, there is a myth again that Covaxin is better than Covishield in India. These are the only two things available in India now. Pfizer, they're all different. They may also come in the coming weeks, but all of them are nearly the same. All of them have about 75 to 80% effectivity, and a few percentage points here and there, 5, 6, 10 points at that level makes very little practical difference. So you please take whatever is available. My concern is that ಯಾವುದೋ ಇದೇ ವ್ಯಾಕ್ಸಿನ್ ಬೇಕು ಅಂತ ನೀವು ಕಾಯ್ತಾ ಇದ್ದು ಆ ವ್ಯಾಕ್ಸಿನ್ ಬರ್ದೇನೆ ಹೋದ್ರೆ ಯು ಆರ್ ಲೂಸಿಂಗ್ ಟೈಮ್. My recommendation, please take the first available certified vaccine that the government releases.
Sir, next to, suppose if a person finds that he is a positive, but he is asymptomatic, symptoms is rala bas banbidide nಮಗೆ. What is the first step? Andre before he consulting the doctor, first andre home medicines agi ಏನು ತಗೊಳ್ಳಬಹುದು? Which doesn't have any side effects.
I'm not a great fan of home medicines. I mean, ಇದೆ ಬಹಳ ಜನ ತಗೊಳ್ತಾರೆ, but he must isolate himself. Okay, he cannot be ಒಂಥರ ಕೂತ್ಕೊಂಡು ಅದೇ ಟೇಬಲ್ ಅಲ್ಲಿ ಎಲ್ಲರ ಜೊತೆನೂ ಕೂತ್ಕೊಂಡು ಊಟ ಮಾಡೋದು ಏನು. he must wear a mask himself all the time, and providing that his residence allows him the luxury of an isolation in a room, he should be in a room. ಅವರೇ ಇದ್ಬಿಡ್ಬೇಕು. ಅವ್ರ ಊಟ ಎಲ್ಲ ಬೇರೆಯವ್ರು ತಗೊಂಡೋಗಿ ಡೋರ್ ಹತ್ರ ಇಡಬೇಕು. ಓಕೆ, ಅವ್ರು ಹೋಗಿ ಪಕ್ಕದಲ್ಲಿ ಕೂತ್ಕೊಂಡು ಊಟ ಅವ್ರು ಮಾಡ್ತಾ ಇರ್ಬೇಕಾದ್ರೆ ಜೊತೆ ಕಂಪನಿ ಕೊಡ್ತೀನಿ ಅನ್ನೋಕ್ಕಾಗಲ್ಲ. ಅವ್ರೊಬ್ಬರೇ ತಿನ್ಬೇಕು, ಅವ್ರೊಬ್ಬರೇ ಇರಬೇಕು. ಈ ತರ 10 ದಿನ ಇರಬೇಕು ಫ್ರಮ್ ದಿ ಡೇಟ್ ಆಫ್ ಡಯಾಗ್ನೋಸಿಸ್. if you do it for 10 days, you will stop becoming infected. 10 ದಿನ. BBMP recommends 14 days by way of abundant precaution. Okay, minimum 10, preferably 14 days. ಆ ಥರ ಐಸೋಲೇಟ್ ಮಾಡಿಕೊಂಡು ಆಮೇಲೆ ಯು ಕ್ಯಾನ್ ಕಮ್ ಬ್ಯಾಕ್ ಟು ದ ಮೇನ್ ಸ್ಟ್ರೀಮ್. ನಿಮ್ಮ ಮನೇಲಿ ಮಿಕ್ದವ್ರ ಜೊತೆ ಎಲ್ಲ ನೀವು ಮಿಕ್ಸ್ ಆಗ್ಬೋದು, ಪಕ್ಕದಲ್ಲಿ ಕೆಲ್ಸಕ್ಕೆ ಹೋಗಿದ್ರೆ ಅಲ್ಲಿಗೆ ಹೋಗ್ಬೋದು, ಅದೆಲ್ಲ ಮಾಡ್ಬೋದು. ಬಟ್ ಫಸ್ಟ್ 10 days, ದಿಸ್ ಇಸ್ ಆಲ್ ಯು ಹ್ಯಾವ್ ಟು ಡೂ. ಇಫ್ ಯು ಗೆಟ್ ಸಿಂಪ್ಟಮ್ಸ್, ಸಿಂಪ್ಟಮ್ಯಾಟಿಕ್ ಅಂದರೆ ತಲೆನೋವು, ಮೈಕೈ ನೋವು, ಗಂಟ್ಲು ಏನು ಇಲ್ಲ ಅಂದರೆ ಬಿಟ್ಬಿಡಿ. ಬಟ್ ಇಫ್ ಯು ಹ್ಯಾವ್ ಸಿಂಪ್ಟಮ್ಸ್, ಟೇಕ್ ಪ್ಯಾರಾಸಿಟಮಾಲ್. ಜ್ವರ ಕಮ್ಮಿ ಆಗುತ್ತೆ, ಮೈಕೈ ಕಮ್ಮಿ ಆಗುತ್ತೆ. ಗಂಟ್ಲು ನೋವಿದ್ರೆ ಒಂದು ಲಾಸೆಂಜ್ ಅನ್ನು ನುಂಗ್ಬೋದು, ಸಲೈನ್ ಗಾರ್ಗಲ್ ತಗೋಬಹುದು. ಪ್ಲೀಸ್ ಚೆಕ್ ಯುವರ್ ರೆಸ್ಪಿರೇಟರಿ ರೇಟ್ ಅಂಡ್ ಯುವರ್ ಸ್ಯಾಚುರೇಷನ್. ಈಗ ದೇರ್ ಇಸ್ ಎ ಕಾನ್ಸೆಪ್ಟ್ ಕಾಲ್ಡ್ ಹ್ಯಾಪಿ ಹೈಪಾಕ್ಸಿಯಾ ಅಂತ. which means saturation is low, but you're not breathless and struggling for air. That is also not a very good condition. Okay. So it is for you to have some scientific basis to know that you're okay. It is good to check your saturation if you know that you are COVID positive. Saturation
So
ನೋಡ್ಕೊಳ್ಳಿ. ಅದು ನಿಮ್ಗೆ 90ಕ್ಕಿಂತ ಕಮ್ಮಿ ಇದ್ರೆ you have to go get into a hospital.
somebody says that it is 94 and less, it's a dangerous zone ಅಂತಾರೆ. How far is
ಕರೆಕ್ಟ್. ನಾನು ಹೇಳಿದ್ನಲ್ಲ ನಿಮ್ಗೆ, ಈಗ ಏನಾಗಿದೆ, ಡೆಫಿನಿಷನ್ ನಲ್ಲಿ 94 ಅಂತ ತಗೊಂಡಿದ್ದಾರೆ. ನಾನು ಇಫ್ ಯು ಸಿ ಮೈ ಸ್ಲೈಡ್, ದಟ್ಸ್ ವಾಟ್ ಐ ಮೆನ್ಷನ್ಡ್ ಇನ್ ದ ಸ್ಲೈಡ್. ಬಟ್ ಏನಾಗಿದೆ ಈಗ, ವಿತ್ ಸಚ್ ಎ ಟ್ರೆಮೆಂಡಸ್ ಶಾರ್ಟೇಜ್ ಆಫ್ ಬೆಡ್ಸ್, ಓಕೆ, ನೀವು ಅದಕ್ಕೋಸ್ಕರ ದೇ ಹ್ಯಾವ್ ನೌ ಫಾರ್ ಹೆಲ್ದಿ ಪೀಪಲ್, ಅಂದ್ರೆ ಹೂ ಹ್ಯಾವ್ ನೋ ಪ್ರೀವಿಯಸ್ ಮಾರ್ಬಿಡಿಟಿ, ಹಾರ್ಟ್ ಲಂಗ್ಸ್ ಎಲ್ಲ ಸರಿಗಿಲ್ಲ ಅಂದ್ರೆ you can wait until it becomes 90 before you get into hospital. But 94 is still the official definition of mild disease. If you are below 94, it becomes moderate disease. Mild disease ge home care, moderate and severe disease ge hospital care.
So ಇಲ್ಲಿ one of my colleague is Divyashi, she has one question. What are the necessary blood tests to be taken by a COVID recovery patient to know that they are very safe?
COVID recovery patients, asymptomatic, they need not take any blood tests. Really, there is absolutely no need. ಅವ್ರಿಗೆ ಹಂಗೆ ಸೈಲೆಂಟ್ ಆಗಿ ಯಾವುದೋ ಬ್ಲಡ್ ಕ್ಲಾಟ್ ಆಗಿ ಆ ಥರ ಪ್ರಾಬ್ಲಮ್ಗಳು ಆಗೋದಿಲ್ಲ. ಬಟ್ ಇಫ್ ಯು ರಿಯಲಿ ಇಫ್ ಯು ಫಾರ್ ಎಕ್ಸಾಂಪಲ್ ದ ಕಾನ್ಸೆಪ್ಟ್ ಆಫ್ ಲಾಂಗ್ ಕೋವಿಡ್ ಅಂತ, ಯು ಮೇ ನಾಟ್, ಜ್ವರ ಬರದೇ ಇರ್ಬೋದು, ಬಟ್ ಯು ಆರ್ ವೆರಿ ವೆರಿ ಟೈರ್ಡ್, ಯು ಆರ್ ಅನೇಬಲ್ ಟು ಫಂಕ್ಷನ್ ವೆಲ್. that can last weeks. Normally ಆಗೋದಿಲ್ಲ, 2 ವಾರ ಆಗ್ಬೋದು, ಮ್ಯಾಕ್ಸಿಮಮ್ 3 ವಾರ. ಅದಾದ್ಮೇಲೂ ಇನ್ನೂ ಇತ್ತು ಅಂದ್ರೆ then you may have secondary infections and secondary problems. ಅದಕ್ಕೋಸ್ಕರ you have to get a blood test done, blood counts ಅಂತಾರಲ್ಲ, CBC, get sugar, get kidney functions done, and a test called D-dimer, which is an indicator for your clotting mechanism. So CBC ಅಂತಾರೆ, complete blood count, blood sugar, creatinine, which measures your kidney function, and D-dimer anta. Ishtu ಮಾಡ್ತು ಅಂದ್ರೆ you have a screening to show that everything is in order.
Okay, ಇಲ್ಲಿ taking lemon drops and steam daily is good? It's a question mark.
No comments. I don't think there is any study on that. I don't think it makes any difference. If it makes you feel good, go ahead. I'm quite sure that lemon and steam doesn't do any harm.
There are 2 questions related to vaccine. The first question is, immediately after recovering from COVID, can we take the vaccine? Whether it's a first dose or second dose?
You see, understand that the vaccine is like getting a disease. So when you have already got a disease, you don't need a vaccine. Okay, at least in the immediate future, in the immediate vicinity, because you're already immunized. You got a disease, so you got an immunity. But there is an second time barbodu ಹೇಳ್ತೀವಿ. I'm finishing it. So there is a concept that you have got disease from one strain of the virus and you may get it from some other strain, and the vaccine that we have is supposed to cover many strains. So the recommendation is that you take a vaccine. If you already got COVID, take a vaccine a couple of months, 2 months later, to cover you for possible other infections from other strains of COVID.
Sir, illi one lady has one question.
Yeah.
Can we take vaccination during monthly problem?
Yeah, no issues.
Okay. So my last question to you is, suppose ಈಗ asymptomatic patient, first remedy ಆಗಿ say for example ಹೇಳಿದ್ರೆ ಡೋಲೋ 650 is the best tablet ಅಂತ ಎಲ್ಲ ಕಡೆ ಹೇಳ್ತಾ ಇದ್ದಾರೆ. ಬಟ್ ಈಗ ನಂದೇ ಪರ್ಸನಲ್ ಒಪಿನಿಯನ್ ತಗೊಳ್ಳೋದಾದ್ರೆ, ಎನಿಥಿಂಗ್ ಅಬೌವ್ 500 ಪ್ಯಾರಾಸಿಟಮಾಲ್ 500 mg ಗಿಂತ ಜಾಸ್ತಿ ತಗೊಂಡ್ರೆ ನನ್ಗೆ ಅದು ಸೈಡ್ ಎಫೆಕ್ಟ್ ಆಗುತ್ತೆ. ದಟ್ ಮೀನ್ಸ್ ಲೂಸ್ ಮೋಷನ್ಸ್ ಆ ತರ ಆಗುತ್ತೆ. ದಟ್ ಮೀನ್ಸ್ ಅದೇ ತಗೊಳ್ಬೇಕಾ, ಅಥವಾ ಈ ಲೆಸ್ ದನ್ 500 mg ಆಫ್ ಪ್ಯಾರಾಸಿಟಮಾಲ್ ಇಸ್ ಆಲ್ಸೋ ಓಕೆ?
Whatever suits you. You know what? See, the dosages and things that we recommend are for a population at large, and obviously it has to be tailor made for the given individual. ನಮ್ಮ standard advice, standard adult dose for paracetamol for any disease, any fever, is 1 gram 3 times a day. That is 2 tablets of 500 milligrams 3 times a day. That's a normal adult dose. ಅದನ್ನೇ ಕಮ್ಮಿ ಮಾಡ್ಬಿಟ್ಟು ನಾವು 650 milligrams ಬರುತ್ತೆ. ಕ್ರೋಸಿನ್ ಪ್ಲಸ್ ಅಥವಾ ಡೋಲೋ ಅಂದ್ರೆ ಇದು 650 milligrams.
650, yes.
ಅದನ್ನ 3 times ತಗೊಳ್ಳಿ ಅಂತೀವಿ. And if you find that it doesn't suit you, you take a dosage that suits you. Nothing wrong in that.
So immediate agi, can we have a video consultation with you? Suppose if any one of the audience suffered from this.
You know, it's very interesting, but I'm not actively, I'm a surgeon. So whatever issue I have given you is based on knowledge and the way we treat our patients in a hospital. So I primarily don't do video consultations for COVID disease. I do video consultations if necessary for surgical disease. Even if you have COVID, I will deal with surgical disease for it. But if you want video consultations, you can talk to our hospital. SHRC ಅಂತ ಇದೆ, ಅಲ್ಲಿಗೆ ಮಾಡಿದ್ರೆ they will arrange it with the physician who primarily deals with the COVID patients.
Okay, sir. Thanks for your patience answering of all the questions.
Okay.
Sir, Principal sir, do you want to say anything?
Sir, you're muted, sir.
Yes, muted. Kaushik, onchur ಹೇಳ್ತೀರಾ?
ಮಾಡ್ತೇನೆ.
You got it now.
Good afternoon. Good afternoon, Dr. Lakshman, sir.
Good afternoon, sir.
In fact, today we're all blessed and fortunate to know about the facts and the myths of COVID-19 through your rich experience in the field of medicine, sir. I express on behalf of SIMS family our deep sense of gratitude from the bottom of heart for sharing and sparing your rich experience and valuable time in creating an awareness about the facts and myths of COVID-19. Sir, your presentation has made us very clear about the roles and responsibilities in flattening the curve of COVID-19. Sir, once again, before concluding, I express my deep sense of gratitude to you, sir, for accepting our invitation for today's webinar and making it more meaningful, sir. Thank you so much, sir.
Thank you very much for the opportunity.
Thank you, sir. Thank you, Lakshman, sir.
Thank you.
For accepting our invitation. Thank you.
Thank you.
Thank you all. Thank you all the audience.
Okay. Bye-bye.